very supportive of our approach on making sure we have a stable network coming out of this. So we don't expect to have to do much additional other than to pull it all together in one document and get it formally approved. Other than that, I don't think there is anything new unless Nicole or Diana have come up with something that I'm missing.
Nope, nothing more from me. You got it all.
Me either.
Okay, thank you. Are there any questions, however, from the board for Anya, Nicole, or Diana? I will take that as no questions, or?
I've heard that
Adam.
telehealth will at least at this point be open and valid September of this year. Is that your understanding as well?
I missed the very first part, Adam. If you could just say what will be open till the end of this year?
I heard that telehealth will be open.
So Diana,
September.
Diana, do you want to cover that one for me?
Yeah, absolutely.
Thanks.
Are we hearing anything?
I thought she was going to cover it for me.
Hope she remembered to unmute.
I'm sorry, my connection just went goodbye. So let me try that again. I'm sorry about that. What originally we had expected with telehealth is that telehealth would end 30 days after the state of emergency ended. What we know now is that that is not the case. It will continue. We don't have all the exact details yet. And when we were on a call earlier today, we are expecting telehealth to remain in some form even after September.
Okay.
There's just been a lot of there's been a lot of feedback and requests from PIHPs and CMHs around the state for telehealth to continue.
Adam, does that answer your question?
It does, thank you.
Okay, all good. Any other questions for the team regarding the update?
I have a question, Judy. I was just wondering if some type of outline or something was going to be given to the board so we know what the plan looks like.
So I go ahead.
Sorry, Anya.
It's okay.
I'm assuming, are you talking about our reopening plan, Malkaya?
Yes.
The stabilization piece?
I'm sorry. Yes, could you hear me?
If we're talking about our reopening plan, what we are in the process of doing is putting together everybody's calling them a playbook, and we are expected to have our draft ready this week. And it could be and it could be shared, or at least a high level version of it, like an executive summary with you guys.
Okay, thank you.
You're welcome.
Would you be presenting that at the committee of the whole, perhaps?
Or Anya?
We certainly can add that to the agenda if time allows. We can take a look at June's agenda. I think that just went out for review maybe today to board members, so we can.
Well, at least we can have something in writing prior.
Yeah, so we can either do it at the committee of the whole or include it in an update if you want it sooner.
I think the update sounds like a good plan to me. How about you, Malkaya? Does that work for you?
Yes, it does. I got tapped to be involved in the governor's committee or council or whatever you want to call it on reopening the state. So I would like to know what our plans are. Not necessarily at a deep in the weeds level, but just to have a better understanding of what our plans are going forward. Thank you.
Sure, we can provide that in a summary form to the board in an update or just via boardable.
Either I think would work fine. Thank you. Are there any other questions? Oh, I'm sorry. I'm talking over somebody, I think. Any other questions regarding the COVID-19 update? Okay, we'll move on then to the March 2020 financial review. Anya?
Okay. So this is the March financials, and as usual, I will be reviewing the charts, not the actual financial statements, which are included in your packet. So you can go to the next slide. I believe it's Sheila advancing slides for me. So what you're looking at here is revenue. So what you can see here, while these are March financials, because our revenue tracker does, our dashboard does show the minute additional payments have come in, you can see revenue for March is just slightly over the prior year revenue. And then when you look at April, April does include that retro payment we talked about. And then when we get a little further down, I'll talk a little more about what we're seeing since the March financials, because it does have a material impact on our full year picture and how it's changing since the March financials were run. So you can go ahead and move on. So eligibles is the big change we're seeing since COVID hit, for lack of a better term. We had an economy that was at the lowest unemployment that we have seen, and that has turned drastically since COVID and the shutdown of the economy and everything else. And so what that means is that the number of people in Michigan who qualify for either Medicaid or Healthy Michigan will go up drastically. And so since these were run, I think you heard me mention it at the committee of the whole, we've got eligibility numbers higher than we've seen in 18 months easily, and they continue to climb. So that's predictable. When the economy goes down, we tend to see more people eligible for assistance, whether that's Medicaid or Healthy Michigan. And why that's important related to our funding is because we're paid on the number of eligibles, not the number of people we actually serve. So while March looks maybe slightly under the prior year's numbers, April and May are quite a bit higher, and we are now also seeing retro for March that are creeping in. So that has a big impact on our revenue going forward for April and May. You can jump ahead.
Quick question, Anya, before we
Yep.
roll. So that's going to happen, if I remember correctly, the state only does retro going back 1 month. Is that correct?
So that's how they used to do it until this fiscal year. So again, that's been kind of some of the fluctuation we've seen with how they're funding us this year, different from last year. So it used to be that the actuary would estimate the number of retro payments and include that in our rates. But now, instead of doing that, they actually go back 6 months. So now we're seeing payments as far back as 6 months from the fiscal year start. So at this point, we could be receiving payments for October still. So those will trickle in over time. So that really does help us when it comes to revenue, because we do see a significantly higher amount of retro payments than when we were just getting the prior month and the actuary had estimated how many were the months 2 through 6.
Okay. So the other side of that coin is sometimes they adjust our rates down because they're seeing us get a significant influx of revenue.
So
has there been any word on that topic?
So we've talked about the retro adjustment and the actuarial soundness of the rates. And because of the current COVID situation, that's something they're banking on, and so are we, quite honestly, that will help us with rates. And so what that does is increases revenue to everyone because of the number of eligibles. They're not at this point discussing any retro rate adjustments to back down. The only time I've ever actually seen them do it is when they initially say, okay, for this fiscal year, we're going to fund you at an increase, a trending increase of 5%, and then they get closer to that time period and say, well, now that we've seen this year, it might be more like 2% or 3%. So not typically in the middle of a year, but I also have never seen them deal with a pandemic either. So I don't expect that. I think that they realize that the system does need the funding at this point, so I don't expect that to happen this fiscal year.
Okay, and then there's still the state's shortfall.
Yes.
That minor few billion here, a few billion there adds up.
Yeah.
But they're not talking about impacting us, I've heard already, not yet.
Yeah, I have
That's
not
good.
heard any talk of retro rate adjustments or anything like that. So fingers crossed that does not happen. So as much as I say, you know, actuarially sound rates are a struggle, the way they do it, to some degree that helps us, because you can't just arbitrarily go back and adjust them down either, because then they're no longer actuarially sound. So
Right, because they're not really marching us to a flat amount that they're hoping to pay us. They really are trying to do it on some sort of levels of usage.
that's what they say. Yes.
That's what they say. Okay, thank you.
Okay, you can move on now. Christine. Oh, thank you. Okay. So this is assets. So this would be typically what you would see from a balance sheet perspective. And so this one does compare this fiscal year to last fiscal year. So what you're looking at is, give me one second, my little bar here is in the way. You're looking at through September 30th of 19 in green and through March 31st of 2020 in blue. And so what you can see is, from an asset perspective, it has gone down a bit. As well as receivables and capital assets. So all of those things that we would expect, given the funding challenges we've had this fiscal year with actually collecting money, between the necessary rate adjustment that happened in April and the other struggles we've had with the HAB services waiver payments and those types of things. But what I can say is, between when these are run, so this would be the end of March, and now, we've received not only the $2.5 million increase for the one-time rate adjustment, but also the eligibility trend that we received for the payment in May was significant. It was roughly another $2 million plus. So it's definitely going to have an impact on how this looks going forward. Unfortunately, because these are roughly 2 months behind, you don't see that yet. You will definitely start to see it in April and again in May, and I do expect to see that continuing for the remainder of the fiscal year. I'll stop for questions in case anybody has questions before I move on, or if there's anything anybody wants to add.
So
This is
I'm,
Hadass. Go
go
ahead.
ahead, Hadass, I'm sorry.
So I actually have a quick question on the past sheet that you showed with regarding eligibility. If someone is receiving unemployment, are they still considered eligible?
So unemployment is different than Medicaid eligibility. So unemployment income could affect their eligibility over time, but it's not the same thing. Medicaid eligibility and unemployment are two different things. Consider Medicaid eligibility insurance, and unemployment is income.
Right. No, I understand. But you had mentioned that there are more people unemployed, and therefore there will be more people eligible.
Right, because they don't have insurance. So therefore they become eligible for things like Healthy Michigan, most likely, and for one of the categories of our Medicaid funding, which is temporary assistance for needy families. So they become eligible for these types of insurances because their employer is no longer covering them.
Right, I understand. Right, no, that's the part I understand, but I'm trying to understand if they get unemployment insurance, not insurance, unemployment, like
Income.
for income, yeah.
Yeah.
Is that income what's counted to determine whether they are eligible or not, or?
It would go towards it, but it's not enough to change them from being eligible in most cases. So someone that's eligible for Healthy Michigan, unemployment is going to be lower than the threshold. So, but someone that is qualified for full Medicaid, if they have assets, that would impact it and could, but it's not necessarily one and the same thing.
Okay. All right. Thank you.
This is Pat.
Yep.
So when you look at your chart, if you look at where we are with cash and investments, when we get the adjustments for April and May, we basically make up quite a bit of that difference.
That is correct.
And then another 2 million. So it looks like we're going in the right direction.
Exactly.
Cool.
Okay. Okay. Moving on to liabilities. What you can see between this fiscal year and last, liabilities have gone down. So that just means that we don't have as many accrued payables and those types of things. Due to state is slightly up. Much of that is typically timing from different payments that we make to the state. Employee payables, you know, I did ask that question as to what that was, and now I'm blanking again. I want to say it's PTO accrual. If Eddie is on, he can text me and remind me what that is. But long-term debt is really the bond on the Resource and Crisis Center. So you can see we just depreciate that over time, and that goes down. Any questions before we move on from that one? Okay. Okay, so net position. So you can see the net position has gone down from the end of the fiscal year. So as Pat mentioned, the next couple of months you're going to see not only will we be collecting what we budgeted, but more than we budgeted. So you're going to see that jump up a bit. So through March, yes, we were down a bit, but you'll see once we get through to April and May, that's going to be much more level and much more what we expected it to be on budget, and then eventually likely to exceed budget from a net position perspective, because the eligibility trend will continue to rise over the next few months. So from a total liabilities perspective, our liabilities have gone down by about $3.5 million. So our overall net position appears to have gone down, but as I just mentioned, the next couple of months should even that out quite a bit. Any other questions? Okay. So in looking at revenue, our revenue is actually up from last fiscal year. And so again, if you remember, when we started the fiscal year, we knew we were getting rate increases. That was when they added money to the appropriation. So we are actually seeing an increase in revenue for the fiscal year. It's just not quite what we had budgeted because of all those different issues we've had this fiscal year. For Medicaid specifically. Now for general fund, we're essentially exactly where we expect to be. County funds is exactly where we expect it to be. That number doesn't change. And then all other includes things like grants and things like that. But we had a few grants that were reduced this fiscal year, as well as some that just flat out went away. So that's why you see that down from last fiscal year. Any questions? Okay. Thank you. Okay, so expenses. So administrative expenses, part of what you're seeing there is a bit of a shift between how things are categorized. So the way, remember, we redid our whole general ledger structure going into fiscal year 20. So our administration is roughly the same. It's just the way how it's categorized that's changed slightly. So it's almost exactly the same as it was last fiscal year. It's just there's some things that are booked to other categories now is all you're seeing why it looks reduced. So from a provider network perspective, you do see the expenses going up. So what you can see going on here is a couple of different things. If you recall, we restructured the specialized residential rates this fiscal year. And part of that was making sure that we were paying an intended and logical amount and way to each of those residential providers. So that does have an impact on our residential expenses. But in addition to that, part of what was going on before was the way room and board was handled. And so room and board is something that the behavioral health system does not cover, and that a person's Social Security income is intended to cover that. So right now, the way it was essentially netted before, meaning it was subtracted from the rate that a residential provider was paid. And so we're trying to very intentionally separate those two things. So the rates are the rates now and totally related to the services being provided and not the rent, because those two are two really separate expenses. And so we're in the process of kind of handling that. So I would say it's about $5 million in total that has to be worked out that essentially will get reduced from that provider network expense. And then in addition to that, we did see a bit of an increase in some of the residential rates for some people that quite honestly were underpaid. And so that's part of just this whole smoothing out and using rate logic that is consistent and fair across all providers, and making sure that we're consistent in our approach. And we had several providers that had situations where we had to continue their prior rates until we worked through a process of reviewing the assessment tools and those types of things that are influencing those rates. So we do see that going up a bit, but some of that stuff will be adjusted later in the fiscal year with the collection of room and board costs and adjustments to what we're seeing in residential expenses as well. So for grants, I would consider that roughly the same at between 3.5 and 3.2 million, and then all other is again roughly the same at 1.3 versus 1.1 million from an expense perspective. Any questions before we move on?
I had a question, Jean-Paul here.
Mhm.
With regard to the grants, and particularly on the last slide, you were saying that the level went down. Is
Mhm.
there is it because grant programs ended, or did funding stop, or what was the result of that?
So I believe we had a couple that basically expired. Let's say they were 2-year grants and they just expired. But we did have one of the larger ones was that Clubhouse grant, which we still have, but originally they had given us $1 million for that. And so what they saw in that first fiscal year is that we were only reasonably able to spend about $250,000. So they went ahead and adjusted the grant amount for us, because then they can use those funds for other areas. So that's the big difference in the revenue from the revenue perspective for grants, whereas you see the grant expense hasn't changed a whole lot because we just weren't able to spend it.
Okay. Okay, thank you.
I have a question, Anya. We're looking at our expenses through the end of March, which is like at the very beginning of the pandemic. So going forward, wouldn't it be a reasonable assumption that our expenses are going to be even greater because of all the additional supplies and things that we had to purchase to accommodate for the COVID-19?
Yes, so we will see expenses go up. So as it relates to, like, say, PPE supplies, we did get that one-time GF allocation from the state that has thus far covered it. It was about $230,000. So you just haven't seen that added to this yet from a revenue or an expense perspective. What you will start to see, though, is that enhanced compensation that we started on March 16th. So that's not reflective here yet. That takes some time to show up. But then also we will be getting the funding in June for the $2 increase from the department. So most of that will be a wash between the enhanced compensation that we started and the $2 the state is giving us. But there may be a slight amount that the expense is higher than what we get in, because we did start it on March 16th, whereas the department didn't start it till April 1st. So there are some of those nuances, but those shouldn't be material in the grand scheme of things. But we felt like it was important to start it for any forward-facing staff that were still, seeing people face to face during the stay home, stay safe order.
And then the other thing I'm wondering too is, how is this going to affect the end of year with all these unexpected expenses that we had to incur? How is that going to impact us as an organization, and then how is that going to impact our network? And what kind of provision are you, if possible, I guess I'm wondering what kind of plans you have in terms of how you're going to handle the extra that we had to pay
So
with the closeout at the end of the year.
Yeah, so the majority of that will be covered by the $2 that the department is sending us in June. We just haven't collected it yet. We didn't want to hold up that being distributed to direct care staff, so we went ahead and said, you can start basically billing us for that starting when you turn in your financial status reports in April. Most of it should be a wash. And then we did get that grant that we received from not a grant, the GF allocation for the personal protective equipment. So most of it should be a wash, because what we did was moved everyone, as I've mentioned in a lot of those COVID updates, we moved everyone to cost reimbursed contracts, which basically just means that we don't, it's not reliant on an encounter to get them their costs covered. And we felt like that was important when it was all hands on deck in an emergency situation, so that people weren't worried about cash flow and getting people their paychecks, because we needed staff to still show up. We needed staff to still provide services. So that that will have an impact, but I don't actually expect it to be too material once you count the $2 we're getting from the department for that June, I'm sorry, the April through June direct care wage enhancement. That was a long way to get at your answer. I apologize.
Well, that's okay, because it was a long question. Thank you.
Yep. Okay, I think you can move on. Okay, so net income, you can see total revenue is up from last fiscal year by about $5 million. Total expenses are up again, as we talked about. Total revenue, as I mentioned, will go up again in the next couple of months, because we're seeing it higher than we have expected, due to not only that retro rate adjustment, but also, which should bring us closer to budget, but then also the eligibility trend will likely bring us beyond budget for this fiscal year. So again, that will, Melchiah, that will help offset any additional costs we do incur. So we should be in decent shape by the time we get to the end of the fiscal year. And that net income loss that you're looking at should be close to wiped out altogether.
I have another question, Anya. When we purchased PEE, did we supply all of our network with PEE, or did they have to purchase individually?
So what we did was we purchased it, and then for anyone with a confirmed positive or presumptive positive and serving people face to face, we provided it. And if I'm wrong on that, Christine or Nicole, jump in. But we provided it to anyone that was still in a situation that where they were serving people who were potentially positive or confirmed positive.
Okay, so the individual providers within our network had to secure PPE for their staff.
Not if they had someone that they were presumed positive or confirmed positive, no.
But if they otherwise, because I know where I work, we have masks and things that were given to staff to, you know, because it was just necessary. So that's an additional expense that our network had to incur.
Yep.
I guess it's the question that I'm trying to ask. We did not provide PPE for the network.
Oh, and so
unless it was a person who tested positive.
So Jillian thankfully was able to text me to tell me we did provide general PPE to other providers as well. Thank you, Jillian.
So other providers in the network, but not all.
If they requested it, I think we tried to accommodate if we had it available. But if they incurred those expenses because we moved everyone to a cost reimbursed contract, those are costs we would cover. So that's why we really did that, was to make sure that we weren't forcing providers to incur expenses that were legitimate expenses that we weren't going to cover.
Okay, thank you.
Anya, Judy, when you talk about providing to providers, does that include people served?
So I'm probably not the best person to speak on this specifically, how it was distributed. I don't know if Jillian or Christine wants to talk.
Christine, do you have
unmuted.
You got
there were a number of phases in which, can you hear me clearly, Anya?
Yes.
Okay, there were a number of phases in which we distributed PPE. So on the onset of the pandemic, we went very, very early on. Our chiefs decided to start securing PPE. And so our main focus at that time was to provide PPE in specialized residential settings settings. And again, anytime we created a form, we posted on the website. So other providers as well, if they needed PPE, they would complete the form, and we would provide basic materials that we had, including hand sanitizer, disinfectant, masks. We reserved the N95 masks at the time because they were so hard to come by for positive cases only. We also had gowns that were available to places where individuals were confirmed. So as we progressed in that planning of distribution, we are now currently looking at securing masks for individuals we serve so that when the stay-at-home order is lifted, people are safe to move into the community. So we started about a month ago that planning process of making it available to people we serve, including those in vocational and employment settings.
So just to add to that, anyone with a confirmed case that was reported to the Oakland County Health Department, they did provide full PPE. So we were kind of just the backup PPE that the county did not supply. We then pitched in to make sure we were ordering and getting it for people as well. Thank you, Jillian, again.
Thank you.
Okay.
Anya, I'm sorry, I
Yep.
just sent you
Go
a
ahead.
text as well. But the other thing is that the state of Michigan has also been working on shipments to us of
Yes.
PPE.
Yep. So we've now received 2 shipments, I believe, and then they did mention today on the phone that they're asking what we still need from a PPE perspective and talking about, stocking up, for lack of a better word, because if and when a new wave does hit, that we would be prepared more so than we were the last time. So the state is starting to provide that for us and the network as well. Thank you, Diana.
So does that include when we reopen, having that PPE available for people when they're able to, go back to more ordinary lives?
Yeah, so we're required as an employer to provide masks and things like that. So there are some very specific requirements now in place for each employer that will have to be provided as people go back into the office. So those things will all be in place, and then hopefully we'll be able
Mike's
to.
house.
Yeah, I've seen it already.
It's nice.
John Paul, I don't know
Oh.
if you want to mute.
Sorry.
That's
just looking
okay.
at
Sounds
something.
like fun.
So hopefully we'll still continue to get the PPE, and we'll be prepared should this happen again.
Okay, so in terms of the people we serve when they go back to their ordinary day, will they also, the likelihood could exist that they'll need PPE for that experience also? Where will that come from?
So we are in the process of trying to purchase up to 20,000 cloth masks to be able to help get out to our network, as well as our employees. And when I say network, that is including people served.
Got it. Okay, thank you.
I have one other question. I don't even know if this is part of finances or not, but Judy sent out a Crane's article that providers in Wayne County had to lay off staff. And I've been wondering, we haven't heard anything, but I'm just wondering if any of our networks agencies had to lay off staff during this time.
So not as it relates to our business. So if they're only partially funded by us, then they would have to deal with whatever funding reductions they had on those sides of the fence. But that's why we moved directly into cost reimbursed contracts, because it is our contractual requirement with the department that we have a viable network when this is done. So we switched over immediately, so people did not have to. Now, we did expect, they did do some things where vocational providers that were closed did work with residential providers to help with staffing and those types of things. But we have continued to fund our providers for the business they have with us.
Okay. So long story short, no
I did it again,
layoffs.
didn't I?
No layoffs.
Not from our business.
Okay, thank you.
Okay, I think we're ready to move on now. Okay, So then this is just the chart, and I know Hadass, we don't have the all other on there yet. I know that Eddie was working on that, but this is just so you can see the top 15 providers that we pay on a monthly basis. So that has not changed, but that's just their the amount we've paid year to date. Oh. So that just lists them and tells you what they do.
Quick question for you, Anya. You said that's year to date. Is that year to date through the first 6 months of the fiscal year, or is that?
It should be through the same as the financials, so it should be through the end of March.
Okay, thank you.
Yep. Okay, I think we're all set. You can keep going, Christine.
I'm sorry, before you go on that last page that you just flipped from, I noticed that Oakland Family Services is listed under monthly SUD claims. Don't we have a larger contract obligation with them? They do something with the youth?
So we have a children's services contract with them, but I'm guessing that contract in and of itself did not make the top 15. And so that's why you're seeing the SUD contract we have with them make the top 15. Or it was an oversight that they forgot to say, so kids services for kids.
Okay, thank you.
I can go back and look at that. Jillian says I was right, so thankfully she can text me immediately.
Are there any other questions? Okay, I think we can then move on to the PIHP approval for Amendment 3. Anya, if you'd like to lead us through.
Okay. So your cover sheet has the changes that were included in this particular amendment. And I believe we also have the summary sheet that the department provides on the next slide. If you can jump ahead, Christine. Or not. We did not include that. So in your individual package, you have the PIHP contract amendment summary information. So the majority of the changes that happened in this particular one that were pertinent were related to the adjusted rates that we saw in April. So as you're aware, the rates are an attachment to our contract, and some of the other language cleanups that were included. The summary information is in your packet. This is a group negotiated by all 10 PIHPs, so it is the same contract that they all sign, and it is negotiated in a group that we do participate in. So not only have the other PIHPs reviewed, but we and the internal group have reviewed the changes and are in agreement with them. So this does need board approval to be signed and go back to the department.
Are there questions?
I apologize, we did not include that summary letter in the PowerPoint, but it is in your packet.
Well, knowing what I know about PIHP contract amendments, I'm going to make a motion that we approve this contract amendment because we don't really have an alternative.
You are correct.
True enough.
No matter what they're asking us for.
Okay, so Jonathan has made the motion.
I second.
Is that Pat?
Yeah.
Yes.
Okay, thank you, Pat. Typically for amendments, we do a roll call. Sheila, if you would, please. Did we lose Sheila or she's muted?
I'm guessing she's muted.
Okay.
Just to give her a sec.
I think the behind the scenes for all of us when we do that and talk would be quite interesting.
Well, it's interesting because I see her and she was unmuted.
Maybe I'll ask her again. Maybe she didn't hear me. Sheila, could you call the roll, please, for the Amendment 3 for the PIHP contract?
I'm guessing she's having technical issues because she is muting and unmuting.
Oh, boy.
Hello? Oh, there you are.
Yes.
Hi,
Okay.
There we
Sheila.
go.
Hi.
Could we
Sorry,
still-
I was muting, unmuting. I don't know what was going on. So,
Okay, may we have a roll call, please, on this amendment number 3?
sure. Miss Newman,
Yes.
Dr. Todd,
Yes.
Dr. Hans,
Yes.
Mr. Landsman,
Yes.
Mr. Furman,
Yes.
Dr. Guadalupe,
Yes.
Miss Bernard,
Yes.
Mr. Torres,
Yes.
Mr. Kemp,
Yes.
Mr. Lindemeyer,
Yes.
Miss Namie Dyer,
Yes.
Miss Summers.
Yes, thank you. Our next item is the refunding of the bonds, also an item for approval. Patrick?
Okay. Okay, I'm presenting the refunding of the bonds. This is a action item. Oakland County has requested OCHN's board to approve the refunding of the bonds used in funding the Oakland County Resource and Crisis Center. This is a recommended for the board to approve because it reduces our overall OCHN's liability by about $480,000 over the life of the remaining years of this lease that we have with the county. The background information, we purchased this, we entered into this lease agreement in 2012, traditionally a 20-year agreement, and 10 years in, actually 8 years in, we're asking us to refund the bonds, which is refinance the bonds. It's a lower rate, lower cost to the board, to the organization. We presented it at the committee of the whole with the details of this, how it's a good deal for us to enter into, and they're just looking for our board to approve it by voting in the action item.
This is Jonathan. I have 2 questions.
Mm-hmm.
One, are there any other outstanding debt that we have at
I can't hear you, Jonathan. I don't know if I'm the only one but you're breaking.
No, you're
Yeah, I
breaking
can't
up,
hear you.
Jonathan.
Jonathan, you can always put it in the comments
All right.
if you'd like. Oh,
I will try it again. I just made my camera go away. So my question is there any other debt that we have, short or long, well, more likely long-term debt, that we have that we could also refinance under this bond, given that it's a lower interest rate?
No, this is some funds that's already entered into agreement, and it's already bundled with some other Oakland County bonds, and they're refinancing multiple bonds at the same time. And we just happen to be included with this benefit, and I think it works to our best interest.
Okay. My other question is there any way to change the terms and conditions of our relationship with them so that once we've paid this debt off, that we get to keep that building?
Now, that's a legal question. It probably would require a whole lot of involvement above my level. I'm sure that the county, I know in the original contract, it said they have the option to give it to us for $1 at the end of the lease. But how likely is that? I don't know.
Well, we'll have to be around and see, won't we?
Yes. And so actually this agreement goes into 2032.
I think we'll both make it.
So Patrick, we're paying for the bond for this building at the same time we're paying rent?
We're paying the bond, and we're not paying rent. We're actually receiving rent.
Okay.
So Yeah, can I just jump in to clarify? So the bond is essentially a mortgage, and the rent that we receive is from Common Ground, because they utilize a large portion of that building. So they essentially pay us rent to utilize the building, which offsets the cost because we do have some staff that are there, so we do have some expense.
Okay.
Are there other questions for Patrick before we vote? Is there a motion to approve the refunding of the bond?
It's Sarah. I'll make the motion.
Thank you, Sarah.
Steve Todd, I'll second it.
All in favor, please say aye.
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 Any opposed? Motion carries. Thank you.
Thank you.
We'll move on to the next item, which is also an approval item regarding our annual plan survey. Nicole?
Yes, hi, good evening. I thought I got the little red warning sign. There appears to be a store moving in. So if you can't hear me, let me know, and I'll just flip my video off. So hopefully this should be fairly quick. Thank you all for your input in the committee of the whole meeting. We took all of your feedback and went back and made a couple of changes. So I'd just like to highlight the changes that we've made before I ask for final approval. So Christine, if you can actually go down to slide 9, the changes are highlighted, so right there. So I think it was Hadass, I'm not sure, who just talked about with all of these different areas breaking out the level of importance a little bit better, because before we only had 3, which was just like a no, a middle ground, and a very. So we took this and we broke this out into more of a 5-point Likert scale, just so that we could better determine how important which area was to people served. And that is also the case for the next question, related to a multitude of services. And the next one, which just has some additional services. So I'm just going to pause and see if there's any feedback related to that change before we go to the next. Okay, a couple slides down, Christine, I think it's 13. So to this one, we added the question about access to personal protective equipment, as well as support to stay connected to family and friends during the COVID response. And on the next question, which would be for a family member, again, we broke it out just into the 5-point scale instead of the 3-point scale to better collect and differentiate that data. For question 8, again, same thing, just for the family member instead of the person served. And the next one, it was the same with the question. So if we go to slide 18, this, I think it was Sarah's feedback to add a few additional age groups to better parse out that demographic there. So we broke that down additionally. And then if we can go to slide 23, I think it was Judy or Malkia asked us to add customer services phone number, so we added it just right to the slide. We debated a little bit about did we want to add it to the beginning or the end, but we figured it would be best just right there when we're asking about it in case anybody wanted to contact them. But certainly if anybody had strong feelings, we can change that. For the questions we ask of the general public, just in terms of our focus, again, we just added the additional options. And if we go to the next one, on this, can we go back up to 16? I'm sorry. I think it was from Malkia's feedback as well. We added employment, or Judy. Yeah, up on the top right there, we added the employment. So if we go to question 18, this is back to the COVID-19 response, but this is for everyone. We added the sharing of resources and the access to personal protective equipment here as well. And those are all the changes that we made based on feedback from the committee of the whole. So if there's any additional feedback or questions or discussion that anybody wanted to have.
Hi, Nicole, it's Malkia. To that one slide where you added employment, I believe I also suggested micro enterprise.
You did. That was supposed to be in parents. You're absolutely right. We'll add that before we finalize it and send it out.
Thank you.
Yep.
Are there any other questions for Nicole regarding our approval of the plan for the assessment?
I have a question, Judy.
Okay, Virginia.
So when does this survey goes out and what is the timeline? What time period will it be open for?
So as soon as we get board approval, Christine and her team will be sending this out through tons and tons of different modes of communication. We'll have it on our website. We'll be sending it out through newsletters. We mail hard copies out. I'm already on the agenda for several community meetings with people who attend clubhouses and drop-ins, and we're working at scheduling more. So it will be open probably until late July, early August, because we need to take all that data and compile it so that we can, well, no, I'm sorry, probably till late June, early July. We need to be able to take that data and compile it in time to present this to the public and to the board in August. So we need probably at least 3 to 4 weeks to be able to compile all of that and kind of parse it down so that we can all work together to build the plan. And I believe I'm on the July study session so that we can all go over the data and start to draft the plan and the high level areas of focus.
Thank you.
You're welcome, Dr. Hans.
Are there any other questions before we vote? I'm going to say, I think we can go forward. Is there a motion to approve the needs assessment for 2021 with the inclusion of micro enterprise?
Motion to approve. This is Eric.
Thank you, Eric. Is there a second?
I will second, Jonathan.
Thank you, Jonathan. All in favor, please say aye.
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 Any opposed? That was kind of a rolling aye. Are there any opposed? Thank you, and good luck in getting this launched, Nicole. There's a lot of good effort in this.
Thanks. Thank you all.
Our next item is the provider network overview. Jillian?
Good evening. I am not sure if you all can see me or not. I've turned my camera on, but I have a black screen. So I'm not sure if you can see me or not. But I'm going to go ahead and get started. So thanks for having me tonight. It's been a while since I have presented to the board. I am Jillian Trumbull. I'm the director of the provider network here at OCHN. And my plan for today is to give you a very high level overview of my team's primary responsibilities. Next slide, please. So I report to the COO, Nicole Lawson. And I think we can probably move right on to the next slide, which is an overview of my team. I'm not going to go through each person on the team, but it's comprised of provider network analysts, support staff, a couple of employment specialists, and then some service coordinator positions. Next slide. This is the slide that I reviewed with the board during the recent board meeting where each team member gave a brief overview. My team is responsible for the oversight of contracts, provider management, implementation of strategic priorities, and we also act as the liaison to the network of providers. There's 14 staff on my team. If you go back to the org chart and count, you'll notice that that doesn't equal it, and that is because there are a couple of positions that were vacant right before we moved into the COVID-19 response that we have not moved forward with filling. So my team oversees, oh, thank you. So I'm going to now go through our annual and strategic plan areas where you will find that my team, it touches pretty much every area, I think with the exception of information technology in the strategic plan. So I'm going to run through those different areas. Please let me know if you have any questions or want more information on any specific area there. So in the administration and operations portion of the strategic and annual plan, my team is responsible for the identification and implementation of any of the needed changes associated with the 1915I waiver. That's the waiver that the state moved forward with. I want to say it started several years ago at this point, and has created some changes in how we oversee waiver operations and has added a few services that were previously not available to individuals receiving services. Under advocacy and self-determination, or I'm sorry, advocacy and empowerment, my team oversees self-determination initiatives. We are responsible for technical assistance to the providers. We have staff who sit on a number of statewide work groups and are looking to continue to advocate for the expansion of self-determination to populations outside of IDD where it certainly has been embraced and many people utilize self-determination arrangements. Next slide. Okay. In budget and finance, my team is responsible for hospitalization trends and costs. I do want to note that my team recently took over hospitalization. So this is something that's a new area for us in terms of contract management. And we're really taking a hard look at how crisis services may be able to be provided differently and what the experience actually is for people receiving services and the costs, et cetera. We also are sitting on statewide work groups related to emergency departments, hospitalization standardization. Many of those work groups are on hiatus right now as we're in the pandemic response period, but they're typically scheduled on a quarterly basis. In terms of supports and services, my team is responsible for, can you go back to the previous slide? My apologies. Under supports and services, we are responsible for the oversight or an analysis of the SED service model outcomes. This was the last service model implemented in the network of providers that my team oversees. So those service models have been in place for a little over a year now, and we continue to model or to analyze all service model outcomes, but that was identified in our most recent strategic and annual plan. And then again, for healthcare and wellness, we're on many of the statewide hospital work groups, including some crisis response work groups and some medical clearance work groups that are looking at how EDs accept people or give people medical clearance to be accepted into inpatient psychiatric units. Next slide, please. Okay, continuing in supports and services. This one I can't really take credit for the implementation of. This is the intensive crisis stabilization, and this was implemented by staff prior to my team taking on crisis services and hospitalization. It is a portion of our crisis response. It's for individuals 0 to age 21 and is an the hope is to divert children who may be in crisis from hospitalization. We do have a grant that will start in fiscal year 21 that will expand that population to non-Medicaid and general fund populations. So we're excited about that. My team also oversees the Oakland Housing Link, which is the housing database that identifies specialized residential homes and where there may be vacancies, and is moving forward with roommate databases and other types of living arrangements outside of licensed settings. Along with housing, we're also involved in work with Community Housing Network on their goals to increase subsidized housing units. That's an ongoing goal for Community Housing Network. They're pretty successful at doing it every year. And one of the things Community Housing Network is very committed to is assuring that people who receive services from OCHN have access to some of those units. My team also, along with other service model incentives, reviews employment incentives, completes the analysis related to that. We have some goals this year related to increases in competitive integrated employment. And we're hoping to see positive outcomes at the end of this fiscal year related to that. And then once again, the SED service models are identified. Next slide, please. My team is primarily funded via Medicaid. There is some funding that comes in from general fund and grants, but for all intents and purposes, our team is funded by Medicaid. Okay, next slide, please. And then I'm going to give a very high-level overview of 3 of the essential functions of my team. One is provider relations, the second is contract management, and then the third is waiver implementation and oversight. In terms of provider relations, my team is the primary liaison between the provider network and Oakland Community Health Network. We do that to provide guidance and support. We answer questions for providers. We help direct them to resources. And if we aren't maybe the correct person, will facilitate getting information to providers or to the correct person to help with what their needs may be. That's handled in a variety of formats. We have quarterly meetings with each provider type. For specialized residential and vocational, we're having weekly meetings right now to assist with some of the COVID response, but typically that would be a quarterly meeting schedule. We have phone calls on a regular basis, emails, pretty much any type of communication that would fall within HIPAA compliance purview we're having with the provider network. That's daily, and everybody on the team has that role. Next slide. Contract management, we are responsible for the oversight of all of the contract documents. My team oversees, it's approximately 150 contract documents when you include the ancillary contracts. So those have to be negotiated and executed on usually an annual basis. Some are biannual, or if it's a long-term care agreement, sometimes those are a couple years before we review and change them. We are responsible for the implementation of any contract action. So in a circumstance where we may have to put a provider in a performance improvement plan or implement, for example, a referral moratorium, it would be my team who would initiate that, who would oversee it, and then who would make the decision, along with feedback from many other people, about when to remove that provider from the performance improvement plan. We complete the service model analysis, and then we add and remove providers to the network. So if there's a need to add additional provider types, my team would take the lead on that. We're also going to be the team that takes the lead in terms of termination of any provider contracts. Why do we do that? To assure a quality provider network. We do that via data analysis, feedback, audit reports, satisfaction surveys, reviews of utilization versus authorization of services, and dashboards, which are part of the data analysis. Again, that's daily. Every team member has a role with that, but primarily it's myself, Adam Hamilton, Rachel Densmore, and Dina Ottman who are going to do that higher level contract management. And then one of the other roles that my team has is waiver implementation and oversight. There's a number of waivers that allow for services and supports to people There's different eligibility criteria depending on the waiver, and my team oversees those waivers. So within my team's oversight, there's the applied behavioral analysis, or sometimes called the autism benefit, habilitation supports waiver, and the children's waiver, and the serious emotional disturbance, or SED waiver. So ABA is specific to children to young adults 18 months to the 21st birthday who have a qualifying autism diagnosis and who, based on the eligibility criteria, would benefit from ABA. The habilitation supports waiver is specific to individuals with IDD whose level of need is such, and this is the qualifying language, that they meet criteria for an intermediate care facility for individuals with developmental disabilities, intellectual and developmental disabilities. The children's waiver is a very unique waiver with very limited eligibility, but what it does is it makes the child a family of one, so it doesn't take into account a parent's income to make them eligible for Medicaid so that they can receive services and supports related to their IDD that they otherwise would not qualify for. And then the SED waiver, that criteria as well is for kiddos who would meet state facility level of care and who have a qualifying SED diagnosis. This is important. It's a very administratively burdensome management, but it's important because it impacts services to people and it impacts how OCHN is funded. So my team has to review every single application. They have to make a decision about whether the person should qualify or not. There's audits related to that. They submit information to what is called the waiver support application that the department oversees. And then the department ultimately makes the decision on eligibility. That is a daily, it's daily work. It can back up really fast. And the people primarily responsible for that are Rachel Densmore, Nada Khan, and Jennifer Van Cleve. People served are impacted, and that our role is really to assure that quality network of providers to provide support and implement strategic initiatives that ultimately impact services and supports and outcomes to people served. Without a quality network, services aren't going to be adequate, much less exceptional. If there's not enough providers, people are not going to receive services. So it's really essential that our team has our finger on the pulse of what's needed in terms of provider services and supports. In the service network impact, again, the provider network team, we are the liaison to the network. We work and communicate with service providers daily. We provide ongoing support. I know when Anya was talking about PPE and any confirmed cases, it was me personally who, anytime there was a confirmed diagnosis, I would link providers with the Oakland County Health Department. So we act as that liaison in a number of unique scenarios and just daily operational scenarios. We also interact with every single OCHN team. My team has to have working knowledge of every area of our organization, so that we can assist with consistent communication, implementation of priorities, and so that we know where to go to help providers get support as needed. And this is just a few of the different areas that my team touches, trying to keep it condensed to one slide. We have an individual who is on the Housing Alliance Board, and that board for Oakland County determines how federal funds are allocated. We have people who participate and lead in the annual point in time count, which is led by CHN, and that's the homelessness count that determines how funds are allocated for homelessness every year. We are involved with Oakland Housing Link. My team has staff who lead the Wraparound Steering Committee, which is a committee of multidisciplinary individuals from various community providers who look at how who is eligible for and needs to receive wraparound services for kiddos with serious emotional disturbance. Again, we're heavily involved with the ICSS, intensive crisis stabilization services implementation, and then independent placement and supported employment, which is an evidence-based employment model for adults with mental illness and individuals with substance use disorders. Statewide impact, again, this is just a few of the areas where my team has some influence and impact. We sit on the supports intensity scale statewide steering committee. That the supports intensity scale is the statewide mandated assessment tool for adults with intellectual and developmental disabilities. We also sit on all of the waiver committees. So when I talked about habilitation supports waiver and children's waiver, my team sits on all of those committees. The various hospital practices work groups. Again, there's state level independent placement supports and supported employment work groups. And then we also sit on my team members, sit on my fast fidelity review teams who complete audits of various evidence-based practices that are implemented throughout the state. So I have, for example, somebody on my team sits on the assertive community treatment fidelity review team. And so he will go out and complete those audits for other CMHSPs of their ACT program. And now I am open for questions.
Are there any questions? I've got a couple. I don't want to monopolize. I know Julie would be disappointed if I didn't ask her something.
If you don't ask me something, then I know I'm not doing it right.
You know that there's something seriously wrong. I'll give you both my questions. They're not related, but you can respond in a way that makes sense to you. Okay. Does your team have a role in oversight on person-centered planning?
We do have a role in terms of person-centered planning. Audit reviews are not completed by my team related to PCP. I believe the PCP audits are completed by the clinical team. It would either be that or quality management. But it would be other people who complete those reviews. And then we do have staff within the organization who are on statewide committees related to PCP.
Well, I know there's a lot of concern about strength, or a lot of interest in strengthening the quality of person-centered planning. And I just wondered if your team had any input on that.
So we are in support of it and advocating for it. I know Dr. Lawson was heavily involved before she took on her new role as COO. And so I hope I'm not misspeaking, and I'm sure she'll jump in if I am. My understanding was the state was looking to implement some statewide training about really getting back to basics related to person-centered planning. But we are also considering doing that here within Oakland County. Okay. Separate from what the state's planning.
Yeah, the state came out with something that we really didn't think was in line necessarily with our values of good person-centered planning applying to everybody, regardless of a disability designation. So at the committee of the whole, when Tricia presented on a training goal for the annual plan this year, Tricia and Stephanie Wilson, our clinical director, are leading the charge in developing a person-centered and family-centered planning training curriculum for us to send out. But our goal is that that work group is comprised of more people and families we serve than professionals that are in the room. So that is, and it's on the annual plan presentation that's coming up next as well.
Oops. Okay. Then I'll move on to my other question.
Always ahead of the curve.
My other question is, where are we in terms of expanding self-determination to all we serve?
Yeah. So I had a feeling you were going to ask me that question, Judy.
Yeah, so I saved it for last.
I actually made myself just a couple of notes because I was anticipating that one. So in terms of individuals with IDD, we've seen increases. We're close to 2,900 people who are utilizing self-determination arrangements within the IDD network. In terms of adults with mental illness, we're still not doing well. There's 15, which is not an increase and not a decrease over last year. And we do have somebody in the SED network who is interested. So we're working through a self-determination arrangement right now within the SED network. In terms of adults with mental illness, I'm going to tell you what we hear, but it hasn't gotten us to where we can solve it at this point. The services that individuals typically self-direct and have the most success with self-directing are your supports, such as community living supports, and who's coming into your home and providing you with that, not personal care, but assistance with your goals. And a lot of times in the adult network, that's not a service that's even authorized, or if it is, it's fairly minimally authorized. And they're looking more at self-directing with outside mental health providers, such as a therapist who might be in private practice or not working with directly with the core provider agency. And what we have found, or what we've heard, is that because the requirements related to self-determination can be somewhat cumbersome in terms of needing to have a self-determination arrangement, needing to have a contract between the individual receiving services and the behavioral health provider. Sometimes behavioral health providers, frequently providers, don't want to sort of participate in that process for the Medicaid rates. So how we get around that, I don't have the answer to yet, but that seems to be what that has been one of our primary sticking points, and really also that just getting clear, consistent information out to people who have mental illness and providers who are supporting people. Self-determination can be complicated when you haven't implemented arrangements yet, and really getting in front of people and helping them understand, and then working with specialty providers who are not affiliated with the public system directly to embrace that has been kind of a sticking point for us, unfortunately.
It seems like that's a long-standing barrier.
It is. And we seems like we'll start to make some movement, and then we take a couple steps back, and then we make some movement and take a couple steps back. So it's certainly still it's still a priority for me personally. It's a priority for Rachel Densmore, who has been our point person for at least 5 years here at OCHN, but was a champion in her previous role at one of our providers as well. But we haven't figured it out yet.
Do you think there's any reason to be encouraged by the idea of reaching people who are younger, who have the diagnoses that you're speaking of, in terms of getting them used to the idea of having more say in their recovery?
Yeah,
so that by the time they hit the adult system, that maybe there's just a cultural shift a little bit?
Well, I think, our ultimate goal with the kiddos is that the services and supports are wrapped around them in such a way that they don't ever hit the adult system. But I think you make a good point that, we're seeing this completely unrelated, but just in terms of even response to telehealth, how younger people respond to it versus people who maybe haven't grown up in a telehealth environment. And kids have a different expectation for their life than people my age and older and slightly younger.
Well, that phenomenon really isn't dramatically different from how self-determination grew for people with developmental disabilities either. I mean, it seemed like the younger people were, the more open they were to seeing things differently, not so system geared.
Well, we are working on our first self-determination arrangement right now with one of our SED providers and a kiddo and family who want to self-direct. So hopefully we'll be able to share some success related to that, and it'll create some momentum.
That's good news. I wish them well. Thank you.
Yeah.
I have a question around self-determination. When the conversation came up before, I can't remember when, but one of the things that was discussed was that there was more information available about how self-determination arrangements would work within the adult mental health population. because every time this subject comes up, I always end up walking away scratching my head. I don't understand how it would benefit adults in the adult population, having been a person that receives services. I don't understand it. So I don't know where that request is. I can't remember who I think Anya, but I'm not throwing you under the bus, Anya, but I'm just saying, you know, in order to sell something, a person has to understand what they're purchasing.
Sure.
And it's a major barrier to me. You know, I can't advocate for something that I don't see the value in. And I understand how it works well within the community of those who have intellectual and developmental challenges. But when it comes to mental health, our systems are designed differently. So when you start talking about purchasing services, I just don't see how that would work. So if I'm guessing it's not a question.
Sure.
Let me rephrase this. I'm on my soapbox about self-determination and adults with mental illness.
Sure.
And if there's information available to help explain how it would work with our population, I would like to get a copy of that so that I could at least understand what the benefit is.
Okay. And, you know, to be honest, I am not certain if there's any documentation or materials that are specific to adults with mental illness. So I'm going to need to talk to Rachel Densmore on my team about that. But certainly we can provide you some materials either way. And if at some point in the future the board is interested in like more detailed overview of self-determination, that's something we can plan for in the future too.
Another reason why I keep bringing this up is because it was instituted in the annual plan as a goal. So to put it in as a goal and not have a clear understanding to the people who are supposed to be the recipients of it, to me, is counterproductive. So I don't know if you're planning on bringing this forward into the next goal or plan, but if that's the case, we need more information.
So the goal itself, as I recall it, was we participated in a grant is not really the correct word because there was no dollars associated with it. But with the Centers for Self-Determination, we participated in I guess technical assistance where we did an in-depth, deep dive related to self-determination. And one of the goals that our previous CEO had was really looking at having potentially looking at different ways for how self-determination is operationalized. So it could have been that there would be one provider who would handle any and all self-determination arrangements, or maybe specialty providers. And that's what that goal was around. And as the previous CEO left, we were getting to that decision point, and we weren't sure where it sat in priorities. So that particular goal has sort of been deferred until we really look at our goals for next year and what our new CEO's priorities are. So I don't know if it will move forward in the same capacity in fiscal year 21, but that is my recollection of the specific goal that is in this annual plan.
Thank you.
Yeah.
Are there other questions for Jillian? Apparently not. I appreciate your presentation. It was very informative. Thank you.
Yeah. Were you able to see me on camera, or do you have the black screen too?
I don't have any Jillian anywhere.
I put makeup on for you and everything.
Oh, wouldn't you know?
Of course. All right. Thank you.
Thanks for the effort anyway. Thanks.
Yeah.
The next item on the agenda is the mid-year update. Nicole?
Yes, good evening again. Anya and I are going to be reviewing our mid-year progress for our FY20 annual work plan. So if we can go to the next slide, please, Christine. We have 6 strategic areas that are comprised of 26 goals and 51 objectives. So since this tends to be a rather large or long presentation due to the length of the plan, my hope is that since Tricia reviewed her goals at the committee of the whole and Jillian just went over several of the goals, is that I will just pause briefly and just see if there's any additional questions, just to avoid a re-review or any redundancy throughout the presentation. So our first strategic area was administration and operations. And the first goal in there is our NCQA accreditation. If you can go to the next slide. And we are 95% of the way there. We're very excited about this one. Marquita and her team have been leading the charge for a very long time and done a lot of work around this. So our final document submission was due to NCQA on May 12th. And we are targeted for our what will now be a virtual review. It was going to be an on-site review the last week of May. So we're excited to wrap that process up as well. The next goal, the value-based contracting and utilizing data. Jillian touched on this as her team is the lead on that. So I'm just going to pause and see if there were any additional questions before we move on. Okay, the next slide. Oh,
I'm sorry, I'm having a hard time clicking, but that's why it's so hard for me to get my questions in and my votes in. But anyway, going back to the data on reviewing the existing models, when will we get another update on that at the board level?
I believe Anya and I are scheduled for July or August to give a full update. Obviously, our FY20 update will really only run through March. Because with the onset of COVID, we moved away from our service models and into cost reimbursed, just to make sure that our provider network was adequately funded through the COVID response. But I think we are on deck for that.
Thank you.
Yep. Okay, so the financial reporting one, gonna have Anya address that one.
Okay, so one of the things that we've been working on this fiscal year is now that we have to do our basically state reporting 3 times a year, was revising that process and automating it to some degree. And so that was one of the things that our contractor, Richard Carpenter, was helping with. So we've come pretty far in that process, and we'll be doing our first report, I think is June 30th. And trying to do it in a different way that is much more automated and takes less time from staff. So in addition to that, and part of that was the new financial structure, and that's when you hear me talk about the general ledger being totally restructured and all of that. That was part of this in order to set it up a little differently so that we could more easily pull the data from internally and the data we get from providers from a funding perspective in order to complete those reports. So making good headway and moving on to being close to finished with those. Go ahead and move on.
Okay, so the provider network development and management. The first 2 items related to implementing changes with the Center for Medicaid and Medicare Services with the switch over to the 1915I waiver, as well as all of our work on the home and community-based waivers transition plan is all on pause right now due to COVID. I was actually just informed today that an email went out to our organizational leads and said that due to the state furloughs, all meetings are canceled right now. So we would be about where we would expect to be, working in close partnership with the state on that. We don't know if we'll necessarily get to 100% of those goals just simply due to the COVID response. So those may be carryovers that we have to continue working on into the next fiscal year. And then monitoring our performance and implementing actions on HEDIS measures. We've been working really closely with the state on some HEDIS measures that they have included in our contract. that are shared measures with the health plans. And so the state's been working with us really closely on data validation and has been leading that. We also have several measures that we're looking at for NCQA, and we have tried to combine those two wherever possible just for efficiency's sake. So we continue to make progress and headway on that. We hope to be a little bit further down the road, but like everything, we kind of came to a screeching halt in March. So we're getting back up and forward with forward momentum on that one as well. So I'm going to pause because we're moving into our next main section of advocacy and empowerment to see if there's any questions. Okay, Christine, if we can go into the next slide. So the next area is advocacy and empowerment. And the first goal is related to civil rights and supported decision making. We do have a work group that Kathleen Kovach had run and Vicki Suter has taken up lead facilitation on. And that work group, the goal is to increase the number of individuals who use various supported decision-making options. So really trying to support people in driving their own lives and moving away from full or plenary guardianship for folks. So the work group had established 3 goals. They wanted to provide training and education to support and contribute to the Developmental Disabilities Council activity, the DD Council through the department and Wayne State, and to provide awareness of the benefit of an advanced psychiatric directive. So the groundwork for those plans is in progress. Again, we would hope to be around 50% right now, but it's going to sound like a broken record. It kind of came to a halt in March. So we're going to get back on track here pretty quickly. And the next goal is related to community education. So efforts at expanding and addressing loneliness. The content expert and trainer in this area was on leave, so trainings were temporarily put on hold, but they are being rescheduled. In addition to that, I was recently appointed to the County Commissioner's Task Force to address loneliness and isolation for the seniors in our county. And so certainly I'll be looking to take whatever I learn and whatever that group develops and hopefully be able to apply it across the board for the folks that we serve to help address loneliness and isolation now. We also wanted to launch a direct care professional employment campaign, which we have achieved. It was launched in January and it was developed with input from people we serve as well as our provider network. And we also wanted to facilitate a network advocacy work group to recruit new members and grow the parent and family subcommittee. So that work group continues to meet quarterly. We just met, I think, a couple of weeks ago. It has more than 120 members representing people served, providers, staff from OCHN, families, guardians, and multitude of community partners. So there are also several subcommittees that meet independently to discuss important issues and then report back to the larger group. And that is all facilitated by our communications team. Our next goal, peer support services. So we wanted to continue to develop and increase peer delivered supports and services across all populations. This was added in as an incentive in core provider contracts, and we have a dashboard that creates progress. So what we're looking for in the first quarter, we wanted providers to increase peer delivered services by 25%. And after the first quarter, 1 provider did make it for specialized residential services. And the other 2 providers, while they didn't hit the 25% increase, did show an overall increase in those encounters. For targeted case management, no provider reached that 25% increase, but 1 provider came really close. We have, though, had recent feedback from the core provider CEOs in that with the increased engagement that they've managed to do with telehealth through the pandemic is that they've actually seen an increase in peer provided outreach and engagement and peer provided encounters. So we're in the midst of running that data right now just to take a look at how telehealth has impacted service delivery and the people we serve. So certainly we'll be interested to see when we give a year-end update how the switchover and the maybe convenience of telehealth for folks has related to an increase in peer delivered services. And then we have the person and family-centered planning. So we just chatted about that just a little bit ago. We're in the process of developing that curriculum and training plan collaboratively and being very person and family driven in that process. We also certainly wanted to increase our network of independent facilitators. We did start contracting with Recovery Concepts for independent facilitation. Prior to that, we hadn't contracted with anybody for that service. And when we talked to our provider network, they overwhelmingly said that since independent facilitation wasn't necessarily used consistently or very frequently, that they would prefer that we hold those contracts. And so I know when we talked about this, when I did the year end for FY19, this had also been a goal there. And there was maybe a little bit of different opinion on that, and that there were other independent facilitators that were out there working for providers that hadn't known that and hadn't had the opportunity. So certainly as we look to continue to expand that network, we are now aware of that and can move forward with that information. Self-determination, we talked a lot about that too. This was just presented by Jillian. We did put a hold on any kind of RFP for self-directed arrangements or for a single provider to lead any self-directed arrangements on behalf of our network, and to increase the number of self-directed arrangements via that provider training. So we have done provider training in past years, and that was what Melkai, I'll throw myself under the bus and pull Anya out from underneath it. Rachel had developed a training across all of our different providers, and so that's what we'll go ahead and send out to you, just so that our providers were aware of what self-directed arrangements were and what that might look like in each of their networks and how that would impact then the people that they support. So now I'm going to pause before we move into budget and finance with Anya.
Hi, Nicole. It's not a question, it's a comment. When you mentioned that we hadn't contracted with anybody to provide self-determination arrangements, Peer Choices used to provide that service when they were up and running. I don't know how long they did it, but they did. So we've been making, trying to make headway in that area for some time. I guess I was just a little surprised that we weren't more cohesive in our efforts to bring all of the people together that are currently operating in that capacity. And I don't know what your plans are going forward, but I'm really hoping that those that have been providing that services will be able to continue to do so under a more, I don't want to say cohesive, but just everybody all on the same page and able to do the work.
Yes. Yep. Now that we're kind of coming out from a daily kind of crisis management mode, we can circle back around and really start digging into some of those things. We just hadn't had the opportunity up till now, but that is definitely noted moving forward. Okay, Anya.
Christine, if you want to, oh, thank you. You can move to the first slide. Okay, so the annual risk plan is due in December, so that was completed at 100%, I believe. I have forwarded that and presented on that in the past. It's an annual contract requirement from the department, so it is something we do on an annual basis and look at what we're expecting from a risk perspective and how to mitigate those throughout the fiscal year. We have taken the fiscal year 20 rate methodology and the adjustments in the rates and projected out revenue. You are all well aware of the struggles with collecting said revenue this fiscal year, but the projections have been done, I would say, probably 6 times over. Basically just trying to make sure we're understanding and projecting the most accurate numbers possible. One of the things we're also trying to do is come up with a more automated way to do that. And so my staff and the IT team are working on a dashboard that takes eligibility and the average rate per category and projects the next month's revenue, which we could then do for the remainder of the fiscal year and then make any tweaks we wanted to on that so that we have a better, more automated way to project revenue just that's able to be pulled up on a daily basis and look at any trends we're starting to see and things like that. If there are no questions, I can move on. Okay, so funding strategy. So one of the things we wanted to do this fiscal year was utilize technology to promote independence and create savings for direct care staff. We started off pretty strong, and then some things slowed down a bit, and then COVID is one of those things that we're going to hopefully come out of and have a lot of new ideas and opportunities just with the way we've used technology. So hopefully we can get that one back on track soon. Looking at hospitalization trends, as Jillian mentioned, her team has just recently taken hospitalization, but one of the things we've seen over the last few fiscal years is hospitalization costs have gone up, not always necessarily admissions or length of stays. However, we are seeing an increase in length of stay due to wait times to get into a state facility. So that one, again, as we climb out of the COVID hole, we can start to focus again on that, but there's a lot of nuances to that that just take some time to kind of sort through related to Medicare and lifetime days and different payer mixes and those types of things. Service models for substance use. One has been drafted for, I believe it is the residential service for substance use, but prior to being able to share that with providers, we kind of closed everything down with COVID. So hopefully we can get with them fairly soon to walk them through what was developed and start talking about what outcome measures would look like for that service model. The initial goal being to start to pilot that on October 1st, which may or may not be doable depending on the provider feedback we get when we roll that out to them. And then finally, implement and evaluate new funding methodology for specialized residential services. So that started at the beginning of the fiscal year, has been implemented and had a few hiccups just related to the not the evaluation, but I'm drawing a blank. The scoring of the DLA 20, which influences rates. And so we took the time to go back and allow providers and core providers and residential providers to work through any differences of opinion during that period. And then, so that's almost complete, just with the remaining few that have to be worked out. So that one is at 90% already this fiscal year. If there are no questions, we'll move on. So another goal this fiscal year was to now move on to unlicensed settings and the methodology for that. So one of our overarching goals has always been, and expectations with the department has been to have equitable funding for equitable services. And as we took back on contracting directly with residential and community living supports providers, we found that we needed to take a look at that methodology. And obviously, specialized residential was first, as I mentioned on the last slide. Now the goal is to look at the unlicensed settings, and as the state moves away from the per diem code to report that and back to a 15-minute code, that does allow us some additional flexibility in how we fund that in a more accurate way to fund. So while it may be more reporting, it is a more accurate and a more sustainable way to fund it because you can keep track far better of the situation at the time and fund it appropriately, which is of course our goal. So I'd say we're about 40% done with that. There's been some logic drafted. It's just a matter of sitting down to review it and then walking through that with providers, getting feedback, and that whole process that we engage in. Again, barring no questions, we can move on. And finally, this is always a goal, is at funding advocacy with the department. What we have seen in the last couple of fiscal years is the administration with this department has a very different approach that we appreciate and has listened to us and heard the concerns. The additional appropriation that was added to the budget going into fiscal year 20 was sorely needed and much appreciated, and we've continued to see that kind of partnership with the department. And they have engaged us with their actuaries to start to talk more thoroughly about rate development and independent rate models and those types of things, all of which either myself, my staff, or other staff in the organization participate in to make sure that we're influencing those decisions in the best interest of people served. You can move on. Okay, Nicole.
Okay, thank you. So our final area is health and wellness, and the first goal related to that is our care coordination. And so we always are looking for opportunities to enhance collaboration with Honor Community Health as well as the Oakland County Health Division, certainly along the lines of data sharing and technology healthcare solutions. We are working with Honor on some enhanced data sharing and collaboration, but we're also looking at entering into a partnership related to behavioral health homes. And Emily Patterson and I will be bringing you a full presentation on all things behavioral health home next month. So we can get a lot more in depth in terms of what that means and what that partnership with Honor might look like. We're also have brought to the county a pitch to co-locate some of our access services with their co-located health division and Honor sites so that we can create kind of a one-stop shop, no wrong door for community resources for our community as a whole. And then we always look to collaborate in the statewide Medicaid health plan PIHP meetings and certainly hit all of our contract expectations so that we can earn back our $1 million+ withhold that are tied to those expectations. So we continue to be active participants in that. We continue to hit all of our metrics to earn our withhold back. And we are right where we would expect ourselves to be for this time of year. The emergency department and hospital visits, the participation in ongoing work groups. Jillian touched on this in her presentation. So I'm just going to pause and see if there were any additional questions from her presentation. Okay, I'm going to move on to population health management. And certainly we are always looking to refine the complex case management, which is what we offer here for the folks that have the most intensive and high level needs so that we can coordinate across systems and with health plans. So our nurses and Stephanie Wilson and Dr. Rosen all work very, very closely and have integrated healthcare meetings with all of our providers. They meet monthly across all 8 health plans that are in our county. And they discuss what's going on. What are they seeing? We look at the data to see what trends. Are there chronic conditions that people are experiencing more often than not? Are breaking it down by population served, by age, just so that we can continually refine and respond to the needs of those folks that have the highest need. And then using ProAct and Care Connect 360. So just a reminder for folks, Care Connect 360 is the website in the adjudicated claims database that the state gives us access to. And ProAct is a software solution that we purchase using grant funds that we receive from the state that has all of the HEDIS measures or the quality measures readily built into it. So we use all of that data then to inform training and to continue to try and figure out who might be at higher risk of hospitalization. So hopefully we can intervene early and avoid that type of intervention for people. Behavioral health homes. I mentioned Emily and I are going to be giving a presentation, I believe, at the full board meeting in June. We were approached in, I think, mid FY19 and asked if we would be willing partners to help the state revamp the behavioral health home model. So we've been working very closely with the department and have recently identified our project lead, who's Emily Patterson. And so we're very happy with the progress we've made so far. And despite the COVID, are prepared for an October 1st start date. And we're right where we would expect to be. And then in terms of the one key local partner for behavioral health homes, we have identified Honor Community Health in addition to all of our core providers. So I'm going to pause before we move into services and supports. and just see if there's any questions. Okay, so our children, youth, and families, in addressing the needs of children, youth, and families, implementing the Youth Suicide Prevention Work Plan. That is continued. That is one of the 5-year grants that we had that expired this fiscal year. When Anya had mentioned the lower grant funds, that was a really large grant we had received. We are working closely with the Health Division to look at federal funds and apply for a grant for suicide prevention across the board. It doesn't just have to apply to youth. So hopefully we'll continue to get grant funds and continue those efforts. And then developing incentives to improve outcomes for kids. Those are in our service models, and Jillian touched on that in her presentation earlier tonight. Our justice initiatives. Embedding REACH services in the Oakland County Jail in order to reduce recidivism and addressing barriers while allowing for greater access of service. We continue to have staff that are in the jail working very hard, even through the COVID crisis. Those staff remained either telehealth or face-to-face in the jail. And then creating access to reach at least 50% of the public school student population to assist with identifying any mental health needs. And we're right where we would expect to be there. What was really interesting is when we ran our data for the first and second quarter is that 48.9% of all of the referrals we received were indirect from schools. The other roughly 50% did come from the circuit court, from the family division. So that does tell us that we're making great progress with the outreach to the schools. We were really happy with that. And moving into crisis services to just continue to evaluate the intensive crisis stabilization services is a relatively new service. Jillian also touched on this one. So I'm not going to go in depth on that, but I will pause just to see if anybody had any additional questions.
I'm trying to hold off to see if anybody else has any questions, but I want to go back to the youth.
Yeah.
Since this school year was interrupted by COVID and it's not real clear what the next school year is going to look like, are we making any additional adjustments on how we're going to be able to reach the youth if they're not in physical buildings?
We know we need to. We just haven't been able to get there yet.
Okay, thank you.
Yep, we're just coming out of crisis mode, so we know that there's a lot of those things we have to consider and readjust to. Any other questions? Okay, culturally competent services. Tricia presented on this one at the Committee of the Whole on May 11th. We continue to implement our 5-year plan, and we are implementing our plan specific to military and veterans family strategic plan as well. So I don't want to repeat kind of Tricia's update, but I will pause just to see if anybody has any additional questions. Okay, and then moving on to the social determinants of health, looking to increase employment. This is also included in our service models that Jillian touched on earlier. We are very happy to say that in the month of December, our network experienced the largest number of individuals to have ever been served in supported employment to date. And that resulted in a 25% increase from September of 2019 to December of 2019. So certainly our provider network was outstanding in terms of making sure that people who wanted access to that service had access to that service. Again, it's something that we're going to have to look at and readjust with this new normal that we're living in, but we're about right where we would expect to be in terms of our mid-year update on this particular goal.
Quick question.
Yeah.
How many people did we have that gained employment?
Well, that number I shared was the number of people who were served in supported employment. It's a 25% increase. I don't have the actual number, Jonathan. Sorry.
Okay.
Looking at the Oakland housing link, again, Jillian went into the housing link and talked about this during her presentation, so I don't want to give the board a repeat, but I will pause just to see if anybody has questions. Okay, then another social determinant of health moving into transportation. And hopefully within the next couple of months here, you'll have a full transportation presentation. Mike Daly, with a lot of support and talent from Sheila, have been working really stringently on this as well. So we're looking at increasing transportation options, looking at increased rides, reduced costs, those types of things. And so looking at the block grant requirements that we had for mileage reimbursements and vouchers, we've been making really good progress on that. And then in terms of fulfilling the other FTA grant that we applied for, we are well on our way to finalizing the report of that grant, and that's going to allow us to identify the overarching barriers that the people that we support are faced with in terms of transportation. And then it's also going to have some very specific recommendations about what we can do as a system to help overcome some of those barriers and engage community partners. With that, I think we also have to take into consideration that we know that Uber, Lyft, and other transportation companies have laid off a lot of their employees just simply due to lack of business with the pandemic. So that's going to play a big role into that as well. But we are making good progress with both of those grants and hope to have a very in-depth report to the board within the next couple of months. And our substance use prevention and treatment, we have implemented all of our contract requirements for substance use disorders for people who are on probation or parole. So that's the MDOC contract that I'm sure many of you heard for a long time. We were the first PHP to get that up and running, and Christina and her team were really wonderful in terms of just project management, rolling that out and working really, really closely with our community partners. And then we continue all of our opioid related prevention and treatment services. Again, we're right where we would expect to be in terms of progress throughout the year. So then I'm going to pause because we're going to move into technology and innovation and just see if there's any questions. Okay, moving into technology and innovation. Our first goal was to migrate at least half of our dashboards from iDashboards over to Power BI, which is the Microsoft 365 dashboard. We're about 35% there. Again, we're coming out of crisis mode. We had a solid 3 months there where we were fairly well tied up, but we just had a meeting earlier today, and Diana and Jenny Follis and their team have a very clear-cut plan to keep us on track for the remainder of the fiscal year. And then collaborating with providers to look at a pilot to supplement staffing and promote independence. This is along the same lines of what Anya had referenced in her update in terms of just financing technology that might lead to greater independence or support for people to help combat things like isolation or loneliness. So again, things that we've met and then we kind of fall off and then we meet again. And with our new normal, we have to kind of take a step back and reconsider what all of this looks like. And then last but not least, our health information exchange. We were the first PHP to submit admission, discharges, and transfers through the Michigan Health Information Network, better known as MyHIN. So whenever someone enters into our system, leaves our system, or changes providers within our system, we send out a notice so that any other provider also serving that person would receive a notice and know to reach out to us to coordinate care. Also looking to partner with Honor to receive lab and medication data for people served. We've had a lot of conversation around that. There's a lot of different nuance to it, just in terms of it would be entering into a contract with a third party, funding and budgetary needs around that. as well as how that then figures into what the state is supplying us, because they continually supply us with more data. So we don't want to pay for something that the state might then give us access to. So we continue to kind of wade through that, but with technology and everything changing so fast, we're trying to pace ourselves so that we can kind of stay on the leading edge without duplicating sources or and continuing to be wise public stewards of public dollar. So with that, that is the mid-year update. Did anybody else have any questions?
That's a remarkable amount of information you provided to us.
That's very kind of you to say, Judy. Thank you.
We do appreciate the effort, but it is certainly a lot of necessary, but very intricate in so many ways. The kind of information, how to kind of merge it into wisdom and knowledge is the challenge, I guess, for all of us.
Yeah, I'm hoping that as we move forward with this, that as the directors continue to present, they can get more in depth with the board. And then maybe instead of mid-year, I can go through quarterly and only present on what you haven't already heard. Just something to make it, I think, more digestible or easy. But certainly as we start talking about what we want to do with the FY21 annual plan, something we can work on together.
It seems to me that if there's a way to break it down a little bit, I think that we might all get a little bit more meaning from it. But it doesn't mean that it wasn't highly informative, and we appreciate the effort that went into preparing it.
Thank you.
Are there any questions before we move on? I think we're good to go. Thank you.
Thanks.
The next item on our agenda is other business, and at this point I've asked Dr. Guadalupe to give us a search update, if she would, please.
Yes, I will. Thank you. So just to let everyone know where we are at, sorry, just want to make sure you can hear me. There we go. At this point in time, I just was able to get a date scheduled, and it looks as though we're going to go with June 9th for our meeting. This way we won't be, same time as committee of the whole. So June 9th at noon, we will be scheduling our meeting. So Sheila, if you hear me right now, I'll send an email out tonight, but if you could help get the notice out for that meeting, during which time we will review data points that Edna and Anya have presented to us, as well as Blair from the Hunter Group, so that we can come up with a contract for our CEO candidate. So again, Tuesday, June 9th at noon. And I would just like to say, Judy, if I can for a quick moment, because I have to log off here in just a second, but I want to really thank Edna and Anya, Judy, and the committee for everything that they've done. This has been a lot of putting pieces together and making sure that we've got everything going in the right direction. And I really appreciate the guidance from Anya and Edna throughout this process. So thank you all. And as well, just on another note, Anya, thank you for everything you've done by stepping in as our interim CEO. I really appreciate all the hard work.
Thanks, Sarah.
Well said. Can you stay around if anyone has any questions for you?
Oh yeah, I can stay for a couple minutes.
Okay. Are there any questions for Dr. Guadalupe regarding the search
Sarah,
process?
this is Pat.
Okay.
Yes.
Were we able to get the information from the state on other compensation of various CEOs around the state at other organizations?
I was recently provided with some information from Bob Sheehan's office at the state. The only kind of caveat with that is that it's not all CMHs. So Edna prepared some documents which should be available here in the next day or so that we can get out for everyone to review. But like the survey that they take that includes the salaries doesn't include like Wayne County and some of the other agencies. So we'll have some to take a look at, but it does it by budget size. But
what in Wayne County be budget size?
Well, it's a voluntary report. So they can voluntarily share the information, and they've chosen not to share that information in the survey.
That says a lot right there.
But our plan is to have that out in the next day or so. We've made requests from Blair to get the research that she's done, and we just want to put it all in one packet so we're not overwhelming everyone. So as soon as we get all that together, I'll have Sheila or Judy or I will send that out to the committee.
All right, thanks.
Yeah.
Any other questions for Dr. Guadalupe? Well, you were very nice to thank everybody else, but thank you so much for staying on top of this process and keeping us moving forward. You've done a great job. Thank you.
Thank you. And I do unfortunately have to log off, but I'll talk to you guys soon. Have a good night.
Good night.
Bye.
The next item is our director's report. Anya?
Good evening, everybody, again. So, as we've mentioned multiple times tonight, as we kind of claw our way out of emergency management, just looking back at from the beginning in 1963, the Michigan Public Mental Health System has been a pioneer in service delivery, starting with the transition from institutions to community-based services and advocacy initiatives to ensure equity and parity for people through the American Disabilities Act, and recently offering innovative solutions to integrated physical and behavioral health supports, and while protecting services related to privatization. So, that same perseverance and drive is definitely what brought us all together to continue to be innovative and serve people during a pandemic, and with conviction, resilience, and compassion. And it as I mentioned before, it's just been amazing to watch people come together and be a part of that, and just being willing to do anything to make sure that people get the services they need. So now, as we think about phrases like PPE, physical distance, and quarantine peppered spaces and things, we are trying to start to look beyond that. And now we're trying to start to focus on some of the things that we've learned, some of our prior priorities, and future delivery of services in the public mental health system. That we were able to address very quickly and changed on a dime, really. In terms of working with providers, with telemedicine, and working with the community and providers to make sure that all concerns were addressed, and make sure that the vision of the past pandemic is over, and that we are focused on the future and what we learned from that. And definitely telehealth has become, the strongest piece of that, in just that, we were able to safely still serve people with our network and the dedication of people in this system. And as we work to start to, plan for having PPE available on a regular basis, and advocacy for funding and enhancing programs, we just want to make sure that we are always focused on the views and values of the people we serve, and that's really come through in the past 3 months, and our focus on providing services to them, and how everyone has really come together with the provider network and sharing resources within the provider network. And we'll be utilizing that in our future planning and conversations, as we start to go back to thinking about supporting direct care wage, professional wages, education, employment, and housing and transportation back into our new normal, as we've said a few times. So that's it. Thank you.
Thank you, Anya. Are there any questions for Anya regarding her report?
This is just Pat. I would say that from my perspective as a board member, a parent, and a person in the community, I'm just incredibly impressed with what the team at OCHN has done during this time period, because they stepped up big time and did some terrific work. So thank you.
Yes, thank you. We appreciate that. It's really, as Nicole would say, or Dr. Lawson would say, teamwork makes the dream work, and we couldn't have done it without everybody on our team and the provider network and all of their staff just being so willing and capable to make it happen.
Great job.
Is there anyone else who would like to make a comment or ask a question of Anya regarding her report? I do think that we can't praise this team effort enough, and the focus on the people we serve was remarkable. It just was remarkable. So thank you all. The next item on our agenda is the reports from the committees. We'll start with the Recipient Rights Advisory Committee. Jonathan?
Thank you.
Mm-hmm.
The Recipient Rights Advisory Committee met virtually on May 7th at 4 o'clock. Richard Zemark was who's our RAC chair, was the facilitator. Vicki Suter, Director of Rights and Advocacy, provided the following updates. The governor signed PA 55, which updated the health code related to investigations and allows parties to choose mediation. It also had definitions, and it identified who can participate, and most importantly, the timing. Because these things, when there's an issue that's been raised or a request, they should be investigated quickly. Under the revised PA 55, when a request has been made, they now have 10 days to start that process, then they must be completed within 30 days. And if resolved, the decision is binding and enforceable in the courts. So a little bit of progression in some of the public acts that are out there. Gene Fender, the manager of Office of Recipient Rights, reported that we covered a topic called guardianships. So generally, for those that don't know, a guardianship or a guardian is someone who has been given control to be personally responsible for the person and the physical well-being of an adult. And this happens through probate court. And it doesn't just happen on a whim, and it's not just for mental health. It could be for almost any kind of condition, so long as this adult who would normally have their own rights to make decisions, etc., are legally incapacitated. So a guardianship is needed when an individual lacks sufficient understanding or capacity to make or communicate informed decisions about his or her personal well-being because of impairment. There are different types of guardianships. I don't have the definitions to them, but plenary, partial, and limited guardianships, and there are areas of guardianship support. So, and there's a process that you go through when it goes through probate court. And again, probate court, and it handles this for all of them. There's a petition, there's appointments of the guardian, there's a hearing, and then the official appointment itself of them once someone's been identified and they've had the hearing for them to be the appointed person. As well, they can be overturned and withdrawn from, if you petition the court. So it's not it happens and they throw the key away. Their rights and abilities to regain your control of your life, if you will. What else? Jean also said that they added another new rights specialist. Her name is Brittany. She came on board at the end of March. So she's the first new staffer in that space to go through training and mentoring, and she had to do it virtually. So it added a whole new layer to it than working across the table. So she did that. She'd completed her basic 1 training and passed the exam. And sometime this month she was scheduled to take basic 2 training. I don't know if she's had that and if she's passed the exam. The next area was Vicki Suter reported, who's as I said before, the Rights and Advocacy Director. She reviewed with us RR 8.1, which is policy RR 8.1, and that's communication and training for OCHN. So this covers OCH employees, residential care employees, contracted health employees, subcontracted employees, out-of-county contract agencies, their employees, professional contracted, and they're all, persons as well. They're all required to meet the training standards specified by MDHHS and those qualifications or hurdles that we at OCHN set as well. So, and one of those is all new employees must complete recipient rights training within 30 days of hire. And for an agency, they must have 95% compliance rate. So that means they have to put everyone through it and they have to pass at that kind of thing. Anything less than 95% of the new hires calls for a corrective action. The next topic was site reviews. I know we've covered this before. We haven't covered it in a while. But we do site reviews every month of facilities. We're at 180 of 430, so about 41% through the end of March. Even though that's like 6 months, most of the on-site reviews happen over the summer. So we will definitely catch up and be done by the end of September. I say we, it's really collective of OCHN, of OCHN, and I've not actually done one, but there are others that is what they live for. So also it was sort of interesting. There was a question raised during the recipient rights meeting about incidents being reported. And they wanted to know, one of the members of the committee wanted to know, is there more or less given this whole COVID outbreak? And according to Jean and Vicki, they've neither increased nor decreased. There was an initial drop because there was, we were all sheltering in place, but ultimately it came back up and we remain at about the same level as in past years. So anecdotally, you might think that they'd either go up because everyone's, cabin fevered, if you will, or they might go down because no one wants to do these things, but the numbers have stayed the same. So sort of interesting. You wouldn't have guessed that. Our next meeting for RAC will be virtual again. It'll be next week, Thursday, the June 4th at 4 p.m. If anyone's interested, we can pass you the contact information so you can join us as well. Thank you.
Thank you, Jonathan. Are there any questions for Jonathan regarding his report? It certainly was a meeting that covered a lot of important topics. I really appreciate that everybody made the effort to meet virtually.
And we did, and it was very active and interactive, of course.
That's great. Very good. Thank you. The next item is the report from the Citizens Advisory Committee. Melkaya?
Thank you, Judy. I had to remember to turn my mic on.
We all do.
And my camera. The Citizens Advisory Committee met virtually May 20th. The meeting was called to order by our chair, Lois Schulman. Introduction of members and guests were given. The chair set aside some time at the beginning of the meeting to do what would be considered a member check-in, just wanting to know how people were doing in the midst of the shelter-in-place orders and what people were experiencing. Victoria Lansman from Community Housing Network provided members with resources to assist with COVID-19 related issues. Under new business, Christine Burke discussed moving the in-person events that OCHN normally sponsors to virtual platforms. Some of the events that we discussed included the Get Out the Vote initiative, the annual Your Voice, Your Vote conference, as well as the July as Minority Mental Health event. Dr. Nicole Lawson came in to give the COVID-19 updates to the group, discussing the activities that staff had been engaged in during the time of being sheltered and in place, including securing and delivering PPE to our provider network and looking for ways to help assist people we serve with access to online resources and equipment to do so. Vicki Suter did a presentation around the stigma wellness tip, which was a discussion about Maya Angelou's quote, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And after that, we did a roundtable discussion on what we could do to help make people more respected within our network. Under old business, I was asked to do a brief summary of the CEO search and the outcomes of it. The chair, Lois, did request by FOIA to get the resumes of the two top candidates, Dana Lesenberry and Brad Casemore. She received redacted copies, which were distributed to the membership because many had been wanting that information. Members who had reports gave reports or made announcements of upcoming activities. The meeting went well in this new format. There were a few challenges, but for the most part, it was a very successful meeting. Our next meeting is scheduled for June 17th, 2020, which will more than likely again be in a virtual setting. And my report is respectfully submitted. Malkia Newman, Board Liaison, OCHN CAC. Thank you.
Thank you, Malkia. Are there any questions or comments for Malkia regarding her report from the Citizens Advisory Committee? Your committee was equally busy and covered some really important topics. I'm quite sure that we're all getting a little bit better with this virtual meeting kind of phenomenon. By the time we get really good at it, we'll probably not have to use it anymore, but I'm glad that you had good participation as well.
We did. And I will email a copy of my report to Sheila.
Sounds good. Thank you.
Thank you.
The next item is the report from the Oversight Committee. Eric?
Hi, thank you. So there was an invitation extended to me to join the Oversight, the SUD Oversight Policy Committee on the 21st. And then we had the meeting that I attended virtually was on the April 22nd. So not knowing much about the committee, I'm going to have to ask for a little forgiveness on my report. May seem a little disjointed because I'm not as familiar with the operations of the committee as maybe I should like to be in the future. Anya had given a report on COVID-19. She had reported that the telemed functions had been working well, and she had given a report regarding enhanced compensation. The substance use group, the providers have been doing a great job with telehealth. There was a report by Sherry Williams regarding treatment. Sherry's the lead clinical analyst, and she had reported that the providers have been good in adhering to all the OCHN guidelines. Megan Phillips gave a report about access services. She had reported that the staff a lot of them were working at home and doing a lot of the SUD screenings by phone. Rachel Rhodes gave a prevention services report, and providers had been working remotely to give prevention services except for Common Ground. And then there was quite a bit of discussion about some of the there's actually vacancies on the board, and there are several different categories of vacancies that need to be filled. There's no representation from veterans. They need to find someone who has worked in long-term prevention. They need a peer that's been active in recovery, that receives services, and they need somebody that has a religious affiliation. We also had a bit of a discussion at the end of the meeting regarding what are people that are in recovery, how are they accessing meetings? How are they dealing with their recovery? And if for those of you that don't know, most people that were going to AA meetings as an example, most of those meetings were shut down and they quit meeting. And so a lot of people started going to online, doing meetings kind of like how we're doing them. But there's a lot of issues surrounded with people going to AA meetings, sitting in front of a computer. It's just not the same. And so we did have a report from one of the members of the committee. I forget the woman's name, and she had actually reached out to the governor's office, and there was a clarification from the governor's office about how AA meetings could be conducted, AA or NA meetings could be conducted. And they can be conducted if you're using social distancing guidelines. So I was able to get a copy of that letter and send it on to people that I know participate in several AA meetings around the state. And that was that's about all I have to report.
Well, thank you very much. You're off to a very good start, and I hope that you are gaining as much insight as you are offering to the committee. I'm sure you have a lot of positive and informative points of reference for them. So thank you for your participation. We appreciate it. Are there any questions for Eric around his report? Hearing none, we'll move on then.
Not a question, Judy. Just want to encourage Eric. You did a great job for your first time.
You certainly did.
Thank you.
Not to mention all of the information from our committee reports today was really quite insightful. I appreciated hearing them. Thank you all. Our next item is our second opportunity for public comment. Christine, do we have anyone who provided comment to us?
No, we do not, Judy.
Okay, thank you. The next item then would be board member comments. And Sheila, would you just call off the roll and we'll get our comments in that way? Is Sheila with us?
She's there. I see her muting and unmuting again, though. So I think whatever issue she had.
We can wait.
Can you hear me now?
Yeah. Thank you.
Oh, good. I don't know what the issue is. Okay, so let's, Miss Newman.
Hello. I was really surprised, considering the fact that we are sheltered in place and my team and I are working from home, but this turned out to be a really busy May is Mental Health Month in spite of the fact that we were sheltered in place. I'm just really grateful for many things in spite of all of the difficulty and the pain and suffering that people have been going through with this pandemic, with this crisis, not just locally, but all over the world. I'm encouraged by the show of compassion and empathy that people all over the world are showing to each other, which helps to soften some of the blows for some of the other not so nice things that are taking place. It grieves my heart when people die in some of the situations that have happened recently and some of the other things that have happened recently that point to our differences. And it's concerning. I was on Facebook and somebody made the comment that if you were an African American mother, how can you send your children out and not be afraid? And it's a legitimate concern. That's one of the main reasons why I'm very encouraged at the efforts that this organization is taking to tackle diversity, equity, and inclusion. Is more important now than ever before that we learn to be accepting of people and celebrate our differences instead of not. I was on a Zoom meeting that the One Stop Shop at Oakland County was putting on around small business. And in the middle of that meeting, somebody Zoom bombed the meeting, took it over, and started writing the N word all over the screen, and used expletives. And I was shocked. I had never seen anything like that. I know that it happens. It wasn't like it was a minority meeting. It was just myself and one other individual in that meeting that was a person of color. But it was just shocking to me how insensitive people can be. So sometimes I feel like I push too much. But it's personal for me. Um, and I asked the rest of the staff and the board to please be patient with me when it comes to these issues. It's heart-wrenching for me, and it's painful in more than one way, but I'm still encouraged. I'm very encouraged. This past week, my team had the opportunity to do a virtual presentation to on my own Michigan, which is a provider of services to people with developmental disabilities, and it was a fantastic presentation. They were so encouraging and so uplifted, and I just know that there's so much good that's coming out of a bad situation. And I want to celebrate the good. I want to be a part of those that are a voice for change and a voice for caring and compassion and social justice. Because if one person suffers, regardless of what they look like, we all suffer. You may not recognize it that way, but we do, because we're all connected. We're all part of the human family. And when one person hurts, we all hurt. So I appreciate so much all of the hard work that this staff has done. You've been exemplary during a very, very difficult time. As usual, you take on responsibilities and you do your jobs well. And I am so thankful and so honored to be a part of this board and a part of this network, and just a person that lives in this county and has been a recipient of the services that have been provided here, that I know are some of the best in the state. But even with that being said, knowing that we still have to roll up our sleeves and tackle some really, really difficult things, locally as well as on a national scale. So I appreciate the meeting. I appreciate all of the information that was shared. I appreciate my fellow board members and the comments that they make. And I again appreciate the staff so much, but I even appreciate those that question us and bring their comments to us and want us to make the best decisions that we can, because for them it's personal. They have family members or they themselves are receiving services, and they want to make sure that it's done in a way that respects the dignity of the people that we serve. So now I'll get off my soapbox and let someone else speak. Have a good evening, everyone.
Thank you.
Bob?
I got a couple of things. One, I think a lot of people know this already, but if you think you want to test for COVID-19, they're available. Anybody can get a test at the state fairgrounds. You just need to go online and get an appointment. And then the test for the antibodies, maybe you were asymptomatic and you had it, or you were sick and you never were sick enough to go get tested. Your own doctor probably has the test. There's a couple of hundred tests out. Only 8 have been approved for emergency use by the FDA, but they're called the ELISA test, E-L-I-S-A, the type of a test. Abbott has one, Roche has one. And all the Beaumont urgent care walk-in centers will give you the test. You don't need an appointment or a reason. Just you can either walk in or go online and make an appointment there. My other comment is I see something very hopeful at this board meeting of respect between the board and the staff, which I thought needed some work in the past. Nicole had given us the presentation on the survey, and some board members had made some suggestions. And then when we came for the approval of the final survey, those things were all incorporated. So I guess it makes a difference how suggestions are made and whether we respect each other. But I look on it as a foreboding of good things for the future. And I agree with all the things that Malkaya also said. That's all.
Hello, can you hear me?
Yes.
Yes, Dr. Hahn.
Yeah, sorry, I think I was unmuted. Yeah, a lot to think about. The presentations were excellent today and learned a lot again, and some of the things that were like a refresher. Malkaya's comments also give us a lot to think about, especially in these times when you know, we are all at our wits' end, but I really commend the leadership at OCHN for all the work that they did to, you know, bring us through this time, this difficult challenge. And I want to give a shout out to all the direct care staff who I have first-hand experience with. Just I could not have asked more of them for caring for all the individuals. So I think they have to be commended for that. So thank you for everything that you do. And that's the comment.
Mr. Kemp?
Yeah, thanks, Sheila. Yeah, just a couple things. I agree with what everybody said before my turn, but I think it's terrific the way that the OCHN is focusing on achieving the goals that are part of the annual plan. And the review tonight was great to see. I think that's important that, you know, you set up a plan, you set up your goals and your objectives and so forth, and then you just pound away and go after them. And understanding you have to make some adjustments along the way, especially, you know, nobody could plan for COVID-19. But you still hung in there and you're resilient and focused on achieving them. And I think that, you know, brings to another thought that I have is the teamwork is very impressive. And to Steve's point, not only within OCHN and your leadership and your, you know, people on the ground doing stuff, but as well as with the board. I think it's great to see and great to have the conversations and have candid comments accepted, and people are good with that. And I think that's how we can, you know, make progress and keep moving forward. And then to add to that, especially some of the things Anya was talking about earlier, some of the creativity and the innovation that you have taken on as an organization is really impressive, because you can't sit around and worry about yesterday. You know, you got to say, we just got beat up now. how can we move forward, and how can we take advantage of it? What are we? I've been saying it a lot in, just in my conversations in the community, that there's going to be a lot of good that comes out of this because you're forced into it. When you're forced against the wall, you get creative and you try to get innovative and try to figure out better ways of doing things. And for example, we're doing this board meeting, online. It's not ideal. You'd like to all sit at the table and talk, but I think it says that that OCHN is grabbing the bull by the horns and moving this thing forward. And I also, one last comment is, it's really great to hear about the survey, because I think bringing in the community and reaching out to the community is just so important, to let them know that we're representing the community and we're fighting for the community. We're advocating for the community and trying to help the community in any way we can. And I see and hear that all the time in the presentations of the team members who come forward and the leadership team sharing what you're doing. And I think that's just terrific. So good job. Very comprehensive meeting. I know it's a long meeting, but I think it was very worthwhile. Thank you.
Mr. Landsman.
There we go. Thank you. I can't say enough about the boots on the ground, the folks that are out there providing direct services and supports to our folks that we serve. It's amazing how you do that day in and day out, despite putting yourselves in peril. And I know, because I've seen that both in the hospitals but out in the field. So it's amazing. At the same time, what's even more amazing is, while we have lost a few of the folks that we serve, we haven't lost as many as we could have. There's some intercore strength across the specialty populations we serve, and I think that's amazing. I'm just glad to see that we're going to slowly come out of this. The world may never be the same, but we will persevere. That's it. Thank you.
Mr. Furman.
I just want to again echo, and well, not echo, but just thank Malkaya for her heartfelt comments a few minutes ago. In addition to, again, complimenting the staff on the very comprehensive presentations tonight. Just again, along the lines of what Jonathan said, just kudos for the entire network, serving the individuals that we support, and really learning how to do that on the fly. So thank you very much.
Ms. Naomi Dyer.
Yes, I just want to say I always enjoy these presentations. It really gives me the opportunity to learn a lot more about this agency. So it was really beneficial for me, and I really enjoyed hearing from the other committees as well. And then I also just want to say to Malkaya, thank you for your words and sharing your experiences, and just to kind of leave with some words to remember that those who are unaffected by social injustice should be just as outraged as those who are. And I think the same sentiments can be said for mental health, and remembering that those we serve are especially affected by situations like this too.
Ms. Bernard.
I also want to thank Micaiah for her very well said comments, and the other board members. I think we all agree with her, and this is a difficult time, but it is a time that seems to be bringing many people closer. And our local community, which to me, our local community is Oakland County. I feel like we have all bonded and gotten closer in somehow. So I also really want to thank Dr. Lawson and Anya and Jillian for these really great reports. And if I missed anyone, I apologize. Also, Eric, your committee report, all committee reports were great, but Eric, you did a wonderful job. So thank you, everyone. And I really appreciate all of you. And that's it.
Mr. Torres?
Oh, can you hear me?
Yes.
Okay, perfect. I just wanted to make sure I had to transition over to a phone. But again, thank you everybody for the presentations this evening and the committee reports, all very enlightening and helpful information. I had a question, and it was when I was transitioning over, so I couldn't unmute myself, but I wanted to ask earlier when we were discussing the CEO, where we're at with the progress with the committee. I remember reading that there was a press release that went out, I believe, that went to the Oakland Press or something. And I just wanted to follow up. Was there a formal press release that OCHN did about the outcome of the CEO search that we could utilize or have? And forgive me if something was sent out. There's just information overflow these days.
Christine, maybe Christine can answer that for you.
Actually, we did not send out a formal press release. We usually, as practice, do not send it out until the contract is signed and finalized. We were asked by the Oakland Press who the final candidate was, and we provided them with Dana's name with follow-up information that we were not making a formal announcement. Her appointment and selection was, of course, pending the completion of the contract. So once the contract has been finalized with the board and with Dana, then we will draft and send a press release out that is approved by the board.
Okay, thank you.
Mr. Lindemeyer?
Hi, thank you. I want to thank Malkia for her words of wisdom. They're so true. I would tell you that I grew up in Northville in the 70s and early 80s, and we were pretty limited in our diversity in Northville at the time. And you know, when I went to Michigan State, and it wasn't until I went to Michigan State that I got introduced to other cultures. My life is so much better as a result of understanding other cultures, that I think that I'm a far better person and my life is so much better. And I do worry that that we're in a cultural crisis in this country right now. And when people are hurting in our community, that's negatively affecting our health. And it's going to be our mental health and other aspects of our health. And I really get concerned with how that ends up being layered on top of what's happening with COVID-19, and the fact that we may have a lull, but based on the behaviors that I see of people in the community, I'm concerned that it's just going to come back as bad or worse as it's been so far. And so I just think that we should really be prepared, emotionally, mentally, for this to continue for a while. And we should have plans with our provider network for this to go on for multiple months until there's a vaccine or there's a treatment for COVID-19. And I'm very concerned that it's just going to multiply all of the other differences and things that we have in the community. It's I'm kind of down about how things, the things that I see going on as well, Malkia. Anyway, that's all I have to say.
Thank
Thank you. And I believe Dr. Guadalupe had to log off, so Miss Summers.
Thank you, Sheila. I just want to say that I always learn so much in these meetings that goes beyond what the presentations really are offering to us informationally. The questions people ask, the level of commitment that is behind the questions, and you're all teachers to me. And I always learned so much more about humanity, along with the, I guess, the nuts and bolts of the system. And I just appreciate everybody who contributes to the effort to help our people be the best people they can be, and to keep our community viable, and that we all need to stay thoughtful and regard each other as we would our own family, and just be kind. It's not that hard. So Malkaya, obviously you always have a way with words, and I appreciate your thoughts very much, but it doesn't cost us anything to just be kind. Thank you. Are there any other comments or questions?
Judy, I just had one question.
Sure.
Regardless of the status of the stay-at-home order from the state, are we planning on having these meetings virtually until further notice?
I'm going to say that until there's a lifting of the numbers of people that can assemble, I'm going to guess yes. I think for the foreseeable future. I'm speculating, but I would guess, we would have to entertain the public. We could be looking at 50, 60 people. We don't know. I don't know when that's going to be an option for us to, meet together.
Okay. Thank you.
That's just a guess. Anybody have any more specific information? Not just my opinion?
Nope, but I'd agree with that opinion at this point.
Well, I guess that, caution is probably the best way to approach things for the time that we, considering what's happening in our community. So if there are no other questions or comments, I will adjourn this meeting. Good evening.
Good night, Judy. Good night.
Good night.
Good night.
Good evening, everybody. Thank you. Thank you for your support.
Good night.